Hi friends, this is Dr. Rajneesh Gulati. I'm a senior gastroenterologist in Delhi, and today we'll talk about piles. Piles are a common man term, and we call them clinically or medically as hemorrhoids. So basically hemorrhoids is the disease of the anal canal. The anal canal is the last portion of GI tract, and it is a dilated vein in this area which when become prominent they bleed, and we call them piles or hemorrhoids. So this disease is increasing day by day, and it is a big cause of concern to the patients, because if somebody sees blood in the stools, it is a very depressing symptom. So most common presentation of the piles is bleeding from the rectum. So bleeding classically is the painless bleeding, that patient passes blood without any pain. He sees his stools and there is a dripping of the blood. So this is the classical presentation or a common presentation of the piles. So usually bleeding occurs after the stools or before the stools. The other common presentations of the piles can be irritation or itching in the anal area, and very rarely they can come and present with acute pain known as a thrombosed piles. So these are the common presentation of the piles, and they are seen in both males and females, and at most young people and old people. But such certain conditions, they increase the incidence of piles. For example, pregnancy. In pregnancy, the incidence of piles increases, and people who got constipation, they got a more incidence of piles. And the bleeding can be very mild, or this bleeding can be very severe, that sometimes they'll end up in the emergency of the hospital. So everybody should be aware that bleeding from their piles, bleeding from their anus can be because of piles. But we should not forget that there are some other causes of bleeding per rectum also. So the, the cause should be identified, and then should be treated. And there are very simple tests by which we can see the piles and tell the patient you got a piles. And the word of caution is that other causes should not be missed. So people with other causes of bleeding from the rectum can also present to the doctor, and they should be sort of sorted out. So firstly, a diagnosis should be made by putting a simple camera into the anus, and then the treatment should be started. As far as piles are concerned, there is a medical treatment and surgical treatment, and the most of the patients which are initial stages of piles can be treated medically by giving some oral pills and local creams. And people who continue to bleed, then we do them endoscopic therapy, we band their piles, or if bleeding doesn't stop, then these patients are sort of referred for surgery. And surgery is not also a big surgery, it's a simple surgery in which the piles can be removed and the patient can be cured. So dear friends, the piles is the important cause of bleeding per rectum, and the proper diagnosis should be made so that you don't miss the other causes of bleeding from the rectum. Thank you.